Hello, everybody. My name is John Ruddy, and I'm that dentist guy. Today, I want to bring you how do I put a loyalty program together in my dental office? And so let's take a look here because I've had a lot of people ask this over the years, and I see this in Facebook groups all the time. And the question is, okay, well, how do I start? What do I do? What do I offer? And so I want to answer some of those questions for you today. So let's just kind of dive into it and take a look. First and foremost, one of the things that you need to know is that this is not an insurance plan. It's really important that you do not call this an in-house insurance plan because if you do, then you could be liable to abide by the state laws for insurance. And so we want to make sure this is a dental benefit plan, a loyalty plan, something like that, something that rings well for your office, but nothing that gets you into trouble. Okay. Second thing is this: by definition, a benefit plan has to be beneficial. So you're going to want to reduce your fees so that the patient can get some buy-in, number one. Number two, enjoy the benefit of being a part of this plan. And so don't get too tied up on like, oh my gosh, that's way too much, because what we really want is this. We want patients to participate so that they feel good about what they're doing and that they'll tell their friends all about it. And so we're going to talk about, okay, well, how much do we discount, that kind of stuff. We'll get to that here in a second. The last thing is you just want to make sure that you track it. Sometimes I have offices that only charge patients the fees when they come in, and that's one way to do it. Another option is that they pay a one-time fee in the beginning of the year or the beginning of their calendar year, and then they will be charged again over the course of time. And so you want to make sure that you track it so that you know where's this person in the life cycle of that year-long plan. And so if they start in October, then you want to make sure that you put I would say a pop-up would be best. I know we don't love pop-ups, but if you could put something that like flashes up, and that way whoever's visiting with them, the hygienist can look on there and go, okay, they are eligible for these things. So let's go ahead and take a look at what are they eligible for. All right. First and foremost, you need to have a plan in your office that's for healthy adults. Okay, you can have a child one like this. I'll get to in a second how to formulate this, and it'd be the same way for children. But ultimately, you want to have a plan that's good for adults to have two cleanings per calendar year, one periodic exam. Be specific on the X-rays, because you don't want to get in a situation later where someone's like, okay, well, I need want to do ortho, and you do a panoramic and you do the full bite wings and all that kind of stuff. So make sure you're letting them know how much they're going to get. So, 6 bite wings or something like that. If that's sufficient, talk to your doctor. And then the last thing is two emergency exams with PAs. And so, and I put two PAs on there. So if they've got like just a mouth, sometimes people come in obviously for an emergency exam, and you're like, okay, this is not an emergency exam. This is a comprehensive exam. So be specific on what you're giving them. Okay. Second, the one is this: your advanced cleanings. All right. You want to make sure that you have something that's suitable for people who need more, right? So as you're talking to a patient who has deep pockets and they have bone loss, and you're saying, you know what, that you've got periodontal disease, this would be a great transition into, hey, I want to give you an idea of a benefit plan that can work for you in our office. I'm going to have our front office talk to you all about it, but it'll be a way for you to get what you need here so that you can be responsible and keep your mouth healthy, but also be responsible with your dollars, and they'll talk to you all about it. And so when you're talking about it, obviously they're going to have more cleanings, right? They're going to have between 3 and 4 periodic maintenance visits, still an exam throughout the year, and then they can still benefit from the two emergency PAs and that sort of stuff. So the other thing that you can include in your plan, and I see a lot of offices do this as well, is fluoride. Okay, so if fluoride is something that you want to make sure all of your patients get, or just include this as the added discount. You see at the bottom there, and I know we don't love the word discount, but at the end of the day, the courtesy for them would be between 10 and 15%. All right, and so you can either add the fluoride to your benefit plan or just give them the extra 10 to 15% off should they say yes to it. But the point is that the 10 to 15% would be for everything else in the office. All right. So if they're getting SRPs, they get the 10 to 15%. If they're getting crowns or root canals or implants, they're getting a 10 to 15% discount on those things, because that's what they would enjoy or something similar from insurance. Now, Keep in mind, we are not competing with insurance. All right, that's not what we're doing here. What we're doing here is we are offering patients who are already paying cash a way to stay loyal to your office, enjoy some sort of discount in your office, but really stay responsible. Really a responsible amount of write-offs in your office is between 10 and 15% for cash paying patients. All right. And so most of you, if you're taking PPO plans, then you're like, whoa, we're way more than that. We're writing off between 30 and 36%. And so this will be a way for you to keep money in your office, all right, because you're not going to compete and do the 30%. You're still making an extra 15% in many cases from, on top of what you would be writing off from your patients that are having the PPOs, but you're still giving them the satisfaction of knowing, like I said, it's a benefit to them, okay? So let's take a look at a couple examples here. This is an example of a healthy adult, all right? And so, I just chose some numbers here because I know you are all over the United States, but if somebody's doing 2 cleanings a year, they're paying around $250, plus the exam, another $150, plus PAs, that sort of stuff. They're spending somewhere between $400 and $500 in your office for each of these things every year, all right? And I know I put 10% there at the bottom, but I did give a range, so it's between the 10 and 15. Obviously, the 15% is first and 10 is next. But I like round numbers. So if you actually did the math, you're like, well, actually, John, it's 391 and 414. I like to keep it simple, all right? So between 390 and 415 is what somebody would pay in your office for your dental benefit plan, okay? And this is for healthy adults. So keep it as simple as possible, all right? And then everything else that they get, anything, from a filling or an extraction or anything else, it's all whatever your discount is, 10 to 15%, okay, on top of that, all right? The next one would be your advanced cleaning. Now, obviously, they're coming in more. I set this up for somebody who's coming in 3 times. You could have an option for 3 to 4, or you can make it all 4, right? And that way, if they come in for 3, then that's fine too. All right. But what I'm doing here is you'll see is I'm adding up what they're already spending, what my fees are in my practice, so that I know, okay, this is how much it costs. If somebody comes to my practice 3 times a year with 1 periodic exams and 2 PAs, then they're spending $735 in my office, all right? So that's the number you're gonna start with no matter what. So no matter what you put into your dental benefit plan, you wanna make sure that you start with that number first and then look at what is 10 to 15% off of that. And that's what this number at the bottom is. It's what it represents. So 625 to 660, they're saving in this plan anywhere from let's look about $75 to $90 by being a part of the benefit plan, all right? Plus all the money off that they're getting from extra work and that sort of thing. So this really should be a way for people to participate more in your office and not just get cleanings throughout the year, okay? One thing that I think is important to note about your dental benefit plan is it needs to be simple. If you don't understand it, then your patients won't understand it. That's why I say put some things in there, like the cleanings and the exams and the x-rays, put those few things in there and then make everything else a discount, all right? That way you're not having to put, well, this is what crowns cost, this is what perio maintenance costs, this is what a root canal costs. Just make it simple for your office, and I guarantee you, you will thank yourself down the road. My name is John Ruddy. I'm That Dentist Guy. I hope this helps. It would be my honor to partner with you. Go to thatdentistguy.com and you can see more about how you can partner with me to make your office the premier office. Get an appointment there and we can set up just a 30-minute free consultation and I can tell you all about it. I hope you're well and we'll see you next time.